Hi friends, welcome to my YouTube channel E2L, OET and IELTS. Also, heartily I welcome you to be part of my Facebook page and group. Thank you so much for your support which you shown for my last video, how to crack OET. Even I've got lots of comment from many of candidates and aspirants that those video really helped them to improving their confidence level. So in today's class we'll discuss about reading part A, how to complete your reading part A before your respective time, and those tips which you need to implement for your reading part A. So before proceeding with our class, if you didn't subscribe our channel, then please subscribe our channel and press on bell icon. So now the first index for our reading part is about what kind of the question paper OET people they will provide you and what information they will give you on those 4 boxes. You people are aware that you will get 4 box A, B, C, D. Accordingly, they will give you 20 questions and you have to understand that this question is belong to which boxes. So now we'll start with our first index, that is about what kind of the question they will set for you and what information they will provide you in particular box. So now we'll start with types of question what they set for us, right? So OET people they set 3 types of question paper for us for reading part A. First we'll start with 1 to 7 question. 1 to 7 question will be about ABCD. ABCD means they will give the questions and you have to find out these questions belong to which boxes or which paragraph, whether it is from A, B, C or D. And it is something similar what we learned and what we did practice during our childhood, during our schooling time, during our college time. We did practice like cross matching, similar like that only. They will never give you question in order wise. They will always shuffle the question, so you have to understand this question is belong to which particular boxes. Tips will provide you after this index, so therefore you will understand how it will be easy for you to identify 1 to 7 question. So now we'll move with the second category of question, that is about 8 to 14 question. 8 to 14 question means you have to write down short phrases. It may be one word or one number and word, or it could be anything. Here how they will set question for you, they will give you a question and you have to find out the answer. It is not bit tricky, it is easy. You have to understand that this question belong to which box. That is important for us because reading part A is about 15 minutes and you have to complete within 15 minutes all those 20 question. It's mean that you need proper attention and concentration. You need to know that this question is from which box. That is important for us, and as well as you have to improve your scheming and scanning method. So here we said about second category, that is about 18 to 40 or 14 question means they will give you a question, you have to write down the answer. Means they will give you a question that what was the minimal dose you have to give for this patient, or they will give you some of the age, etc. The question is about what is the minimal doses, what is the minimum dose, right? So you have to go to that particular box where they are saying or where they are discussing about the medication, and from there you just pick those correct answer. Now we'll move to the third category. Third category they are saying about filling the blank. Means there also you have to write down short phrases, but the question time it is like a filling the blank. They will give you a sentence. In each sentence they will give you a blank line and you have to write down answer in between that. Means it is like a filling the blank, so for you it will be very easy to identify the answer between 15 to 20. There you will get few keywords, those everything will be discussed in our tips class. So you have to understand question properly, and therefore you just locate those particular paragraph and just go and do skimming and scanning. So in my opinion 15 to 20 question, it is very easy in reading part A. Well, so this is about first category in index first, where we discuss about type of question paper, what OET people they will set for you. It will be three type of question paper. One will be start from 1 to 7 question, and you have to find out this question belong to which paragraph. And second is about 18 to 14 question, where they will give you question and you have to identify the answer. And third is about filling the blank, 15 to 20 question, where they will give you one question which is not completed and you have to fill that entire sentence with that particular word and with that answer. Well, now we'll move with the tips of reading part A. But before that, I would like to share with you what content they will give you in boxes A, B, C, D, and how you need to understand that this box it contain this meaning, or this box is contain this particular informations. Well, if you people want to write down the notes, then please take your book and get the pen and please start to write down these points. Well, so now we'll start with what information they provide you in particular box. They give you four box A, B, C, D, and information they will provide you in order wise. I hope you people are remembering your college time, where university people they give you question for 10 mark or 15 mark, right? They said those question paper for 15 mark. It's mean that you need to provide them lots of information, but make sure that those information you have to provide in order. For example, cerebrovascular accident. So if university people they are giving you questions cerebrovascular accident which you need to write for 15 marks, then how you will organize your answer? You will start with the introduction, then you will go with definition, and after that you will write pathophysiology, risk of factor, causes, clinical features, signs and symptoms, investigations, management, preventive measures, health education, and nursing care plan, right? So you have to understand that when you read those book, in those book also they will arrange entire content in this similar way. They never describe or they never explain management at begun and rest of thing they explain later on. No, nothing. They always organize in that way. So our OET reading part A, 4 paragraph they will organize in order wise. So for you it will be very easy to identify this information is belong to which paragraph. And for you it will be very easy to locate those answers as well. What you need to do, you need to keep focus and you need to understand what those extracts trying to say in you. Well, now we'll move with tips for OET reading part A. The first tips is about heading or subheading. You have to read carefully what subheading is saying to you, or what subheading is meaning about that. Well, so in part A, most of the time they will give you about introduction, whether it is about disease condition, about medicines, or about some of the research topic. They will always give you about a introduction, and sometimes they give you types as well, and definition and courses as well. If they have brief brief detail about those particular content, then obviously they will provide you lots of information in particular box. Just before I said in part A they used to give you information about introduction, but also they will add those other point as well, like definition, types, and courses. And B box they will provide you about the risk factor, clinical features, assessment, investigation, etc. And C box they will give you about management, treatment. Sometimes they will tell you about preventive measures as well. And 4 is about ending notes, means they will give you information regarding nursing care plan, health education, planning, implementation, etc. So first tips about heading. Heading means you have to understand in each box what heading they are providing you or what heading they are mentioning you. If they are mentioning nursery assessment, they are mentioning about nursing care plan, health education, assessment, or clinical features, signs and symptoms, introduction, etc. So you have to understand what heading they have, means they are given, and also you have to understand what subheading they are given. Subheading means they have written medication, and below they have written indications or special notes, etc. So you have to understand those subheading as well. So for you it will be very easy to understand those questions. Well, the second tips is about number, units, percentage, etc. So number, units, percentage means you have to understand or you have to locate those particular numbers, the units, and percentage means you have to see your each paragraph where they are mentioning about numbers, where they are mentioning about those units and percentage. So if they are given you questions with numbers or with percentage, that time for you it will be very easy to locate those paragraphs. If they are given you what is the population of India, population of India means something is about numbers, right? So that time for you it will be very easy to understand these questions belong to which paragraph, right? So that time obviously you will not waste your time and you will go for those introduction chapter where they are saying you about what is the current population of India, means that will be something about in number, right? Yeah. So it would be number, units, or it would be percentage, anything. Fine. Third one is about abbreviations. They will give you abbreviations or any short form, but those short form will be in capital word, like BP, like heart rate, HR, and DM, and ADLS, HIV, AIDS, etc. So you have to understand this capital letter where they are mentioning which paragraph, or when did they say about did they write the complete meaning of that word as well, right? So that also you have to understand those abbreviations and those words, whether it is in capital or small letter, that also important for us. And most important is that if you know those abbreviations name, then you should be careful, because sometimes they are giving you those abbreviation name and they will write down the full name as well. So that's your 4 tips there, means about you need to know what does it means those particular word, meaning of word, it is necessary for us to understand. Well, for example, in a paragraph they are saying that a patient condition was hypoxic, okay, and in question they are saying that means oxygen saturation was dropped. So both meaning is same. In question they are saying that patient blood pressure was low, and in the paragraph or other hand they are saying that patient had hypotension. So both meaning are same. So you have to understand what they are saying, whether they may change the question or they may shuffle the question anytime. It is a OET exam, then obviously they just want to know your language, they want to know about your communication skill as well and about your learning skill as well. So be careful when you will start with your reading. Don't say or don't think that I didn't get oxygen here. They may give you O2 as well. Alright. So what tips I have told you, one is about heading. You have to understand what heading they are given you, and also those capital word, abbreviations, numbers, units, percentage, and meaning of that particular word. Sometimes they may use synonyms as well. So this is about the tips for reading part A. Now we'll do a reading part A. So for you it will be very easy to understand that how we implemented those tips into our reading part A. Now we'll read each box. We'll just get those particular information. So just take down the notes. You if you want, you can write down those points as well. Now we'll just go with those particular boxes, particular information what they are providing that each box, and after that we'll move with questions, and after one question will complete. After that I will give you question and answer as well. For you it will be very easy to understand that from where we got this answer, from which particular paragraph. Well, now we'll start with reading part A. Yeah, so you can see notes here. So today's our reading topic is about pneumonia. Well, now we'll go with each paragraph, each box, and we'll understand what information they are providing us. Alright, now we'll start with text A of pneumonia. Well, pneumonia is an infection that occurs in one or both lungs and can range from mild to life-threatening. Some cases of pneumonia will cause a problem in one lobe segment of one lung, while serious cases can affect all five lobes. Pneumonia is often caused by bacteria but can also caused by virus or even fungus in rare cases. Treatment typically includes one or more antibiotics taken by mouth when it can safely be treated at home, or intravenous treatment in hospital setting in more serious cases. So till now what we read, they provide us information about pneumonia, what is pneumonia, and how people get pneumonia or get infected with pneumonia, right? They said us that pneumonia is an infection that may occur one lungs, or it may occur both lung as well, and also it is a life-threatening condition. They said causes oftenly caused by bacteria but also caused by virus or even fungus in rare cases. And they said about treatment as well, means if patient want, then he can continue treatment at home with the multiple antibiotics, but if he's in hospital, then obviously they will start treatment with intravenous therapy. And yeah, this is the introduction. They said about pneumonia, introduction, definition, causes. Now we'll see what the other information they provided is in text. Yeah, they said there are 4 types of pneumonia. They have written 4 types: community acquired pneumonia, hospital acquired pneumonia, healthcare acquired pneumonia, aspiration pneumonia, right? So all 4 types of pneumonia they have written in bold letter. This is our for one tip, right? So if you people know what is the community acquired pneumonia, hospital acquired pneumonia, healthcare acquired pneumonia, aspiration pneumonia, then you no need to waste time to read entire story, because you know what does it mean. If you people are confused about yourself, then please read what they are telling about particular pneumonia. Well, now we'll start with community acquired pneumonia. It is a type of pneumonia is acquired outside of a hospital or care facility setting. It is not contagious except in certain cases of mycoplasma pneumonia, which can spread in crowded environments. Well, so this is something they said that if person who experience pneumonia, surely they will experience outside of hospital or care facility, like crowded environment place. Fine. Second is about hospital acquired pneumonia. Yeah. So this kind of the pneumonia patient may experience during the hospitalization. Is also bacteria and tend to be more severe in community acquired pneumonia because you are already sick, so your immune system is low. The bacteria you contact may also be more resistant to antibiotics. Fine. Third one is about healthcare acquired pneumonia. This is bacteria pneumonia that picked up when you're living in long-term care facility or regularly doing to an outpatient clinic. Fine. Last one is about aspiration pneumonia. This type of pneumonia can develop when you inhale food, drink, gum, vomit, saliva into your lungs. So these are 4 types of pneumonia they have written in text A. Now we'll move with text B. I hope you people have understood what information they have provided us in text A. One they said about it is infection disease. Other hand they said it often caused by bacteria but also caused by virus and fungus. If person want, then they can take multiple treatment antibiotic at home by orally, or if they are staying in hospital, then obviously they will give you intravenous therapy. And they have mentioned about 4 types. Now we'll move with B extract. B extract, they have given us 2 heading. One is about clinical assessment, second is about management, right? Clinical assessment, as before I have told you that in B box they will give you information about assessment, investigation, types, or clinical features as well. So now we'll start with clinical assessment. What point they have given? Take a complete patient history. Yeah, they are saying about records and reports, right? Complete patient history, that's something you need to record it. as soon as possible, including the past episode of complication. Fine. Second, they said about you have to perform standard clinical observation with full ADDS and CWT score or other local early warning response tools. So here something they are telling you about performing procedure, means performing standard clinical observation. Fine. Third point is about performing physical examination describing findings about those courses. Fourth one is about inspect the patient breathing. Are they lifting their shoulder? Yeah, because patient may experience pain or breathing difficulty more when they lift their shoulder, bending upward and sitting straight. Well, now we'll move with another point is about, is there pain on inhalation? Is there any noise made when the patient breathes? Fine. So in clinical assessment, they have given you general information what you need to do once you meet the patient. You need to take the history of the patient, you need to perform the standard clinical observation, and they have given you capital word. Just remember ADDS and CWT. If they ask you question regarding ADDS, then you have to know this question is belong to B paragraph. Fine. And they have told us about performing physical examination, describing findings, and the last 2 point is about percuse the lungs, note if there is any dullness and in what area. Fine. And inspect lips, fingernails as they are pale or cyanosed. Fine. Second is about management. Once you have done all the findings, you have done all the assessment, what you need to do, you need to consult medical officer or nurse practitioner. What they have written in capital word MO and NP, medical officer and nurse practitioner, with the finding of assessment. If the heart rate is increased 120 by 90, if heart rate is 120 per minute or respiratory rate 30 per minute, means patient is cyanosis and hypotension, shock or confusion for patient with the moderate severe pneumonia. See immediate management. Fine. There in another point also they have said about heart rate, respiratory rate, sinus, blood pressure. So in management they told you about MONP, means medical officer nurse practitioner. Besides they have told you about vital parameters, right? So in B box they have given you information about clinical assessment management. Clinical assessment they have told you about patient history, performing standard clinical observation and physical examination, along with describing findings, and percuse the lungs if there is any dullness, if you notice in that particular part, or if you have seen any pale and cyanosed in finger and lips. Well, in management they said about consulting to the MONP, and after if you are noticing patient have any changes in their vital parameters. Well, now we'll move with the text C. Text C, you can see they are saying about medications. Yeah, medication. Now we'll read what they are telling about medication, how we need to take medication, whether it is orally or intravenous, and also we'll go through those particular doses and indication, contraindication as well. Well, now we'll start with text C. Authorize, they have written in bold letter, schedule to aspirin soluble DTP, ISW, IP, AP. Authorized indigenous health worker and isolated practice, a paramedic may proceed. RNSM or something they've written. Scope of the practice when administering or supplying medication, etc. Fine. Now we'll move with they have given in a box what heading they have given: form, strength, route of administration, recommended dose, and duration. And they have written about tablet, dispersible tablet 300 mg, route of the administration is orally, recommended dose is minimum 2 tablets every 4 to 6 hours and maximum 12 tablets per day, and duration is stat dose. Fine. Provide consumer medications and may cause okay. So here is something they are saying about what side effect may cause, that is about gastrointestinal irritation or bleeding. Take with food, so patient can gargle 2 tablets 4 times a day. Fine. And there's something that is written in note: use with caution in patient with asthma. So just remember, if they give you questions in note, where then you have to or you don't no need to waste the time, just read the C paragraph. Use with caution in patient with asthma, right? Now we'll read contraindication. What they are saying: aspirin must not be given to children if the children age is below 12 years, and also contraindicated in patient with stomach ulcer, allergic reaction, aspirin. So contraindication they said about conditions, right? And last point is about use in pregnancy. Category C, contraindicated in third trimester, use caution in first 6 months. So here they given us number and months, right? Number is 6 and they said 6 months. That is about duration and time. Pregnancy or if breastfeeding. So C box they said about medication name, they said about strength, route of administration, recommended dose, duration, not, contraindication and side effect as well. Now we'll move with text D. In text D, they gave 7 subheading, and main heading is about nursing intervention and rationals, right? So some of the plannings, they are telling us that these all are the planning we need to do during hospitalization, and also we have to suggest while patient go back to his home. So we'll just read those subheading. Obtain appropriate labs, antibiotic test, sputum culture. Yeah, this is something they are telling about lab and about those investigation. Second point is about complete full respiratory assessment and detect changes further decomposition as early as possible and notify MD as indicated. Fine. So here they are saying about also auscultation, steroids, breathing treatment, crackles would be required, suctioning. Yeah, here they are saying about procedure. They are saying about suctioning, what they need to do. Fine. Third point is about promote normothermia, warm the patient if hypothermic, cool patient and administer antipyretic if hypothermic. Normothermia, optimize oxygen saturation. This is third point. Fourth is about cluster care. Fifth is about promote airway clearance. Promote airway clearance. Yeah, why we are promoting airway clearance to we want to encourage coughing to remove phlegm. Don't suppress cough unless clinically indicated. Fine. So unless patient condition is not confirmed, then don't suppress cough. Fine. Sixth point is about optimize fluid balance. Patient with pneumonia may not be consuming adequate oral intake due to fatigue and not feeling well, but hydration is essential to healing. So yeah, if patient is not consuming adequate oral intake due to the fatigue and not feeling well, no problem, but patient need to be hydrated essentially for his healing process. Or patient may need IV fluid if PO intake is inadequate. Fine. The last point they are saying about assess and treat pain. If patient is not coughing because of pain, it will only allow fluid to continue to build. Treat pain appropriate and encourage them to cough to clear phlegm. Yeah. So here what's saying, assess and treat the pain. If the patient are not coughing because of the pain, it will only allow fluid to continue to build. Treat pain appropriately. Once you treated pain appropriately, after that you encourage patient to cough to clear phlegm. Fine. So this is what they are saying in 4 boxes. One is about introduction, definition, causes and types. Second box is about clinical assessment management. Third is about medication. Fourth one is about nursing intervention and rationale. Now I give you question paper 1 to 7 question. That is about, you need to look at those answer, and you need to understand this question belong to which paragraph, and you need to write down there. I just read the question so it will be easy for you to understand. Procedure for nursing intervention. Procedure for nursing intervention, where they are saying about the some of the procedure which you need to do for nursing intervention. So here we got 2 keywords. One is about procedure and second is about nursing intervention. Somewhere they said about suctioning, right? Yeah. So if you got the answer, then please write down. The second question is about what to record when assessing a patient. It is about assessment, right? assessment and record. So I hope you got the answer. Then please write down. Once we'll complete the question, then I will give you the answer. Third one is about provide care to affected patient. Providing care to affected patient. Fourth one is about administering the prescribed medication. Fifth one is about different types of pneumonia. 6. Performing physical examination. 7. Advise the patient for further consultation with some of the people, right? It might be medical officer or nurse practitioner. I hope you got the answer. Yeah. So this is 1 to 7 question. You have to understand and you have to go those particular box name A, B, C, D, right? I believe you completed 1 to 7 question, right? Now we'll move with 8 to 14 question. 8 to 14 questions, you have to write down short phrases. First we'll go with the 8th one. What was the minimal prescribed tablet dose for administering to patient? What was the minimum prescribed tablet dose? If you understood the question well, then you just go through those paragraph. 9th one. What is the first step of standard assessment procedure is? What is the first step of standard assessment? Where we read about standard assessment. 10th. Pneumonia may also be caused. Rare case. Rare case. This answer you will get it from A box. 11. What need to suggest to patient to removing phlegm? What you need to suggest to patient? Understand the question, jump to your box, don't waste time and read that story where they are saying you about removing phlegm. Suggesting means something about instructing or encouraging the patient. 12th one. To whom the prescribed medicine applied with caution? To whom? 13. What kind of pneumonia it is obtained by consuming food, water into lungs? You know this question answer, it is aspiration pneumonia, right? Because it is easy one. If you know what is the answer, then don't waste your time to reading entire content. 14. Aspirin must not be given to children. Yeah. I think this answer you are knowing. The given answer is not less than 12 years, right? Yeah. I hope you completed the answer. Yeah. If you completed, now we'll move with 15 to 20 questions. If you didn't complete it, then have attach this entire content in our description, so please don't miss it. Now we'll go with the 15 to 20 questions. Well, so 15 questions. Promote normothermia for optimizing dash consumption. Fine. So 15 to 20 question, I have told you it is about filling the blank. So what you need to do, your answer will be between optimizing and consumption. So this is very easy type of question. So once you will get this kind of question, just pick those particular word, optimizing and consumption, and locate this word into your paragraph. Before that, understand these questions belong to which paragraph, then for you it will be very easy. 16. Do not suppress cough unless indicated. So your answer between unless and indicated. 17. Percuse the dash to not if there is any dullness in that area. So your answer between the and to. 18. Dash type of pneumonia is not contagious until exposed to crowded environment. So this answer you know, right? It will be community acquired pneumonia, right? 19. Use with caution while administering to pregnant patient in the first dash of pregnancy. So you answer between first and of. 20. Is dialysis is essential in healing process of pneumonia infected patients. So what is very essential for patient for healing process? You can take 1 minute time to get your answer, and after that I will distribute you answer from 1 to 20 questions. Then I will start with our answer, and also you can see that we have written particular answer is belong to which paragraph and sentence. Yeah, so first question answer is D, second question answer is B, third one is D, fourth answer is C, fifth answer is A, sixth and seventh answer are B. So this is 1 to 7 type of question. I believe that it was easy for you, right? Yeah. Now we'll move with 18 to 14 question. You can see here I have highlighted those particular sentence or particular word from each paragraph. Well, so question number 8 answer is 2 tablets. You can get it from C paragraph. Question number 9 answer is clinical observation. What is the first step of standard assessment was clinical observation. 10th answer is virus and fungus. 11th answer is to cough. It is written in D. 12th answer is asthma. 13th answer is aspiration pneumonia. That already I have told you before because it was very easy. 14th answer is not less than 12 years. That also I have told you, right? So this is 8 to 14 question. Now we'll move with 15 to 20 question. So 15 to 20 question, as you know, it is filling the blank. You have to understand those two words, those two key words, and your answer will be between of those particular words, right? Yeah. So we'll start with 15. Promote normothermia for optimizing diazidase consumption. So you got this answer from D, right? In third line, yeah. They have written clearly optimizing oxygen consumption, right? Okay. 16. Do not suppress cough unless clinically indicated. 17. Percuse the lungs. Do not if there is any dullness in that area. 18. Community acquired pneumonia. That answer also I have told you. 19. Use with caution while administering to pregnant patient in the first 6 months of pregnancy. And the last question answer is, yeah, hydration is essential in healing process. I hope you people got 20 out of 20 correct answer, right? Yeah. So now what you need to do, practice on daily basis. Follow those tips what I have given you. Go through those particular heading of each paragraph, subheading, bold letter, capital letter, numbers, abbreviations, percentage, word meaning, If you don't have enough reading materials, then just go read newspaper as well, because newspaper also will improve your reading skill. Follow those tips like skimming and scan method. Follow those tips during your daily practice. If you are reading a book, try to find out those bold letter, capital letter, numbers, percentage, extra from that newspaper. So do practice on daily basis. For more queries, please do comment on comment box. So on next video we can do discuss on that particular topic. In our next video will be about reading part B and C. I hope that you liked today's video, and for more video please subscribe our channel and do share with your friends as well. And don't forget to like our video. Thank you so much.